each, and today we will be discussing the report that we are going to issue from the Commission on the Health and Environmental Impacts of Perfluorinated Chemicals. Before we get started, I'll read through a checklist to ensure that the meeting that we are holding is in compliance with the right to know law. As chair of the commission, I find that due to the state of emergency declared by the governor as a result of the COVID-19 pandemic, and in accordance with the governor's emergency order number 12 pursuant to Executive Order 2020-04 and its extensions, this public body is authorized to meet electronically. Please note that there is no physical location to observe and listen contemporaneously to this meeting, which was authorized pursuant to the governor's emergency order. In accordance with the emergency order, I am confirming that we are providing public access to the meeting by telephone with additional access possible by video and other electronic means. We are utilizing Zoom for this electronic meeting, and all members of the committee and selected legislative staff have the ability to communicate contemporaneously in this meeting through this platform, and the public has access to contemporaneously watch and or listen to the meeting on Zoom and via phone by following the directions and links provided on the General Court website. We have provided public notice of the necessary information for accessing the meeting in the Senate calendar. We are providing a mechanism for the public to alert the public body during the meeting if there are problems with access. If anyone has a problem, please email remote-senate@leg.state.nh.us or call 603-271-3043. That's 603-271-3043. In the event the public is unable to access the meeting, it will be adjourned and rescheduled. Please note that all votes taken during the meeting shall be done by roll call vote, though we will not be having any votes today, I don't believe. Finally, let's start the meeting by taking a roll call attendance. When each member states their presence, please also state where they are and if anyone else is in the room with you during this meeting, which is required under the right to know law. Okay, and we will begin, I believe we have in the chat. And why can't I see the chat? Okay, there we go. Okay, we'll start with Representative Rung.
Yes, I am in my seasonal home in Moultonborough, New Hampshire, and my husband is in the next room.
Representative Thomas.
Yes, I'm in a remote office in Merrimack by myself.
Representative Murphy.
I am home in the room by myself, but with a number of children.
And Nikki Forty.
Hi, good morning, everyone. I am in my house in Litchfield. My husband is upstairs and should stay there, but who knows?
And I am Senator Jean Deitch, and I am in Peterborough by myself in this particular room. Okay, so that takes care of the roll call. So what we have on the agenda today is to review the submissions from the Health Subcommittee, the Environmental Subcommittee, and the Policy Subcommittee, and to think about how we want to organize the report and what we need to add in addition to the submissions by these folks. So let's start with talking about the submissions themselves. Does anyone have any general comments that they'd like to make, or ideas on how it would be good to organize the report? And Nancy?
Thank you, Senator. I just wanted to request that maybe we address the Health Subcommittee first. I have to be off the call at 11:30. I don't know how much time it'll take, but I wanted to be sure to be part of that. I have to pick my grandson up at school. So if we could do that part first. Other than that, I have no particular suggestions.
Oh, I think we can easily do that.
Awesome.
So what I'm thinking now is let's just think about the entire report. You've seen the pieces that they put together. So I'm thinking, what do we want to put? Well, obviously, I think we should start with an executive summary that looks at all the different pieces and describes it and describes in as briefly as we can, an overview of what's going on. And then, of course, we have to have a background section that refers to the legislation and the requirements of the legislation. Then we can, I think that background section will probably describe the fact that we saw that there was a very significant amount of work to do, and that some people had more expertise in particular areas than others. So it made sense to have subcommittees. And then that would lead into the subcommittees. Does that seem to make sense?
Mhm.
Okay, and then which subcommittee do you think is it? Maybe the environmental first? Because that sort of lays the groundwork of what the situation is.
Sure.
Does that make sense? So that would put the health second, and obviously the policy would come third. And then some kind of conclusion, which I'm sure will be very, very brief.
And there should also be appendices. We had talked about putting the meeting minutes as an appendix. And Nancy, I forget if there was that letter, the blood requesting letter was another, the blood storage letter was another appendix.
Well, okay, so before we move on to what we're going to include, the very first thing, any document, I'm sure Nikki's going to, our communication specialist here, will say the first thing you have to figure out is who's your audience, right? So let's talk a little bit about who we want to focus this at. So legislatively, I don't have it in front of me. Nancy, who do we give this report to?
And Nancy, you're on mute.
Sorry. We give it to, let me just check. The report goes to the Department of Health and Human Services, the Board of Medicine, the Board of Nursing, and the House and Senate Standing Committees overseeing health and environmental issues. Wait a minute, that's not right.
But it's also available to the public, isn't it?
Yeah, let's get these down first, and then we'll talk about who it should be for. Okay, Health and Human Service, Board of Med. What was after that?
It's just Health and Human Services, Board of Medicine, the Board of Nursing, and the House and Senate Standing Committees overseeing health and environmental issues.
Yeah. Okay, and that will be one in the case of the Senate. Is that more than one in the case of the House? Oh, well, we have energy and environment, and then we have health. Yeah, so that'll be two for the Senate. If they set up the committees the same, well, I guess we do with the existing committees, right?
Yeah.
So that would be, yeah, that would be two for the Senate. How many is that for the House?
Wait a minute, you know what? Wait a minute. I don't think that's correct. Let me just grab my other papers. Hold on just a second.
Okay.
So, I mean, I have the legislation in front of me.
Oh, well, that's what we're looking for then.
Yeah, I mean, so the commission shall submit an interim report November 1st each year. It will be sent to the Speaker of the House of Representatives, President of the Senate, House Clerk, Senate Clerk, Governor, and the State Library.
Okay, so it's none of these, none of these specialized groups. Okay. All right, so it's leadership.
Yeah.
All right, so I think given that, this is, that suggests that we're seeking a little bit less technical than we would if we were going to the Board of Nursing, say. I think that that it would be good to at least have a version of the report that goes to the public. And I think leadership is somewhat like the public in that they are not engrossed in this issue. They care about it, obviously, but they do not have all the background of the Board of Nursing and so forth. So I would be interested in hearing other committee members' feelings about how we structure this, whether we put the submissions of the subcommittees as sort of, maybe we have a much longer overview section rather than calling it an executive summary. Maybe we're going to start with an overview section that would be aimed at the public. Yeah, maybe that's the way we handle it. So Nikki, what do you think of we put together this overview section, which really is aimed at providing the level of information that the general public is going to want, and a number of the leadership will want and will be able to read, in one fairly brief sitting, and then we can put the complete background information and all the reports submitted by the subcommittees. And then Wendy, you were saying to have the appendix, and then I would say the appendix. So I don't think we should include the actual minutes. I think my opinion would be that we include links to the minutes, because this will be an electronic document. I hope we're not going to print this out and submit it to the public. I would hope it would be an electronic document with links.
My only thinking about that, because I have taught tech writing and instructional design on a college level, and
we got more communications people here.
Well, but you always try to make it as easy as possible for the reader, and so I mean, if it's electronic, it's just as easy to include it as an appendix as it is to include a link, and a link just makes it harder for people to access the information. So, I mean, I don't really feel tremendously strongly about this. If you want to have it be a link, I think that's fine, but it just flies in the face of making information insanely easy for people to find.
I would suggest maybe just a link to our website, because we do have a lot of documents on there. We have some background information, and we're linking to native documents. So if we find in the future that there's been an error in one of the documents, instead of that error carrying forth in documents that have been reproduced, all we have to do is make sure the native document is corrected, and then links point to that.
And
I think
again, that's a valid point.
Yeah. I mean, that's always been my practice, because especially when we get into technical information, if someone finds that, we've made a technical error, we only have to correct it in one place or make a notation in one place. And as long as we always point back to that mothership, we don't have to worry about having erroneous information out there.
But the minutes shouldn't be modified. I mean, once they're accepted, that should be a permanent document.
Yeah, but we have that website to house everything. So
Yeah.
Even committee notes. So I think if we could just say, for background information, refer to our website where you can see our minutes, any type of like the variance petition, all of those things. I think personally, what I think the goal of this document should be give a thorough overview. So there's going to be a fine line we have to walk, but we have to realize this is interim. So I don't want people to start getting into it and then get turned off because it's very lengthy or very technical. I agree with you, Senator Deach, having that overview is going to be important because typically in communications, you want to give somebody a bite snack meal. You know, you give them some information. If they want more, then they consume more, but then they can get the full meal if they want. So we don't want to overload people with a lot of information at the beginning, because we have to appeal to a very general audience, and then those that need more then can get it. I also find, like, just with personal behavior, if people see a really long document, they're turned off right away. But if they could, especially if we're delivering this electronically, you know, just click on the link and then you've got the, you know, expanded document. Also, just, I mean, I like, you know, so, you know, we start off small, then build, but when I was looking over all of the recommendations, particularly when we had our policy committee meeting, I think categorizing them in prevention of future contamination, education, health implications, migration. So I think when we present the information in the report, I don't think we would be as effective if we categorized it by subcommittee, because I saw a lot of overlap in what the subcommittees were recommending. And I don't think people are going to care, oh, what does the environmental subcommittee think? Or what is the health subcommittee going to think? They're going to look see, okay, what actions, what learnings came about from this work?
Yeah, I would agree with that, in reviewing the submissions and then being part of the policy discussion. I think it makes sense to try to synthesize it together and more group by intent or you know, pursuit, or what we're searching for. I think it is, as you said, very important to remember it's an interim report, but it's also the first one. So that's where I think having a solid background or overview, you know, we kind of have to place this for people, you know, why was the commission created, you know, which I think Representative Murphy could probably speak to very well. You know, a little bit of the background, you got to give enough to situate why does this exist. And then I think each of the subcommittees did a good job, you know, especially health and environmental, in terms of what have we completed? What is there still left to do? What do we feel comfortable recommending at this point? And then if you take a look at some of that, there is quite a lot of overlap. So I wonder if the structure more of that sort of overview, why do we exist? What have we done? What are we still searching for? What do we feel comfortable with recommendations at this point?
No, that's good. I like that.
Okay, that sounds good. Okay, so that was the
Nancy has her hand up.
overview. And then we could, yeah, just a minute, Nancy. We can have the overview document really be a standalone document that we provide to the public, and then submit the full report to the others. And then, of course, the additional material would be available to anyone.
Yeah.
Yeah, I kind of like that. Nancy?
I just thank you, Senator. I just wanted to correct the information that I provided before about who was to receive the report of the commission. That was the Pfas education bill. This bill was a final. The report was to go to the Speaker of the House, the President of the Senate, the House Clerk, the Senate Clerk, the Governor, and the State Library.
We got that while you were out of the room.
Thank you.
Nikki had it. But
Nikki
thank you, Nancy.
Thanks, Nikki.
Nikki filled us in. Yeah. Okay, so yeah, so those folks we would send the full report to. Okay, well, I like this. We've got a structure then. The overview will include why the commission was created, what we've done, what's left to do, and what we feel comfortable recommending at this point. That's the overview. And I don't know, maybe that includes, I think the background section might be a little bit more inclusive than well, we can decide whether we want to actually include the, what are they, 14? Yeah, I think it's a bit much to include all 14 requirements in the overview section. So maybe we want to do those in a, when we're into the meatier portion of the report. And we'll have the background then would be the 14 requirements from the bill. Okay, and then we can do the environmental. Now, I was thinking that we just, with the exception of the policy recommendations, which I agree we should pull out and do a comprehensive policy section. But if we just take each of the subcommittees' reports and put it in without the policy section for the full meaty version of the report.
Well, I'm thinking, how long do we think this is going to be, this report? I'm thinking, let's say if we describe the process that we use. I mean, we have our intent, you know, it was the genesis of this commission. What's the intent? What's the process we identified for addressing it? And the process would describe the subcommittee organization. And then we could talk about in each subcommittee, what were their areas of priority that they looked at. You know, how did they go about their work? And then the media section would be, okay, what were the outcomes of those committees to date as far as what their recommendations are? There are some policy recommendations, but there's also some other recommendations that don't require any type of response. It's really just like, this is what we notice where we need to have some further study, or this area needs to be further prioritized. And then the specific, then what I would think of the policy, that section, which would include any very specific actions we want done, any legislation that we want to have introduced, or policies that we want adopted by the state. So it's like overview, executive process, which would encapsulate the organization and the path forward, and then specific policy recommendations. And then a summary, you know, just like where we're going from here. You know, what's the path forward in continuing the commission.
Excuse me, Rosemary, when you say policy recommendations, you mean legislative recommendations?
It's not necessarily legislative. It could be recommendations for the communities involved. It could be adoption of or further articulation of rules within DES.
Okay.
You know, for instance, I know we have I think there's a policy recommendation for education of healthcare providers. We may, I know there's legislation, but that's something we can recommend that the medical society pursues now. You know, there are things that are recommendations, but not necessarily we're asking for a legislative remedy. You know, I think there were a couple, correct me if I'm wrong, but I think it was some about limiting further exposure. And it was kind of broad, but it would be like, it may be the policy recommendation is to completely implement the air permit that the state issued for Saint-Gobain and support the town of Merrimack's challenge to the air permit. You know, that doesn't require legislation, but it does require action on the part of the department. And then I think there's some where we talk about new legislation, but then there's some recommendations where we're going to support proposed legislation. So I think if we lump all those under policy, the audience will understand what our intent is better than if we got caught in the actual mechanism of how to make that change.
Okay, I'm putting up, I think I've almost finished here. Legislative recommendations grouped by, let's see. Someone had some suggestions. I think, was this you, Nikki, who had suggestions on how we group these, or was that somebody else? Somebody was saying we should group the legislative recommendations, not by subcommittee, but by category.
Yeah.
Oh, that was you, Rosemary.
Yeah,
right?
yeah.
Yeah.
Like one, and maybe if we could target it by who would be directly responsible for implementing that recommendation. So, for instance, we may have a category.
Wait a minute.
Oh,
I ended up putting these to Ava somehow instead of to
Oh.
everybody.
okay.
Okay. Yeah,
You know,
sorry.
for instance, there's at least one recommendation for education on health implications, to educate healthcare providers. But there's also pending legislation that's going to be introduced about that. So probably education would be a subcategory of that section. One that has to do with specifically limiting continuing contamination of that site, and of further contamination of the soil or the leaching of the PFAS. That might be another section. There's a lot of recommendations regarding the compilation of health data and the preservation of blood sampling. So that might be another section. And some of those didn't all come from the health committee. I think there was one from environmental. So I'm just saying when we get to the policy section, we should not look at it through the eyes of the policy subcommittee, but in general, what were the policies that came forward from all the subcommittees and categorize them by a specific topic that would be geared to people who would implement that. I don't know, did I make it that clear?
Yeah.
Because the other thing I want us to be cognizant of is when we've been working on this for a long time, and sometimes when people are entrenched in an activity like we've been doing, particularly those of us in Merrimack who've been dealing with this issue for a while, we get too far into the weeds. And I think we want to make sure this report is something that people who haven't had any experience with PFAS and contamination can pick it up and read and understand it.
Exactly.
Yeah, absolutely. I like the idea of if we're able to organize it by the party that we feel would be responsible for either the implementation or the protocol change or whatever. I like that idea. I hadn't thought about that when we were kind of talking about it in the policy subcommittee, but that might make a lot of sense, and to make it even stronger, because we talked a lot about wanting the intent to be clear of what it is that we're seeking, rather than tying it to a specific piece of legislation, because it could be that legislation could be amended or anything could happen, but
Yeah.
more of what the intent is, but even taking it a step further of identifying the responsible party.
Mhm.
However,
So can I just ask Alan for a minute? Can you change the requirements on this so that we can save the chat, because it's not letting me, and I just spent all this time putting all this information up and now I can't copy it or save it.
Let
So
me see if I can do that.
could you fix that, please? Okay, go ahead, folks.
I was just going to say, it's clear we've got two audiences. The primary audience is sort of the legislative, the people, or maybe we've got two primary audiences. One is people who are familiar with PFAS, who will be looking at this specifically for the details and the hard sort of science sort of stuff. The second audience is sort of the general public who may not be familiar with PFAS. We're right now we're talking about two separate documents. Sometimes you can combine a primary audience with a secondary audience and get away with it, but it sounds like right now we're talking about two separate documents.
Well, I'm not sure about that. I think that if you think about the governor reading this, he's really going to be more like the general public reading it. You know, he's not in the weeds on this. You know, he's got a whole lot of things on his mind. And so I think that this overview section is what we have to think of as both audiences reading. But the secondary section certainly, and even some of the public might, I think it would be hard to predict whether our leaders or the public is going to be more likely to go into the meatier section of the report. So I'm not sure that we have two separate documents.
Yeah, I agree. I mean, I've been reading a lot of scientific papers on cyanobacteria and their toxins, and I can get through all the abstracts really well, not knowing a lot about cyanobacteria. And then you get into the weeds and I get lost. So I kind of look at it this way, that our overview and our executive summary section, anybody that is even going to open that document will be able to follow it. They'll be interested in it. And then once we get into more of the technical aspects of it or the real heavy specifics, the general peoples, they've already been served. They've received the information we want them to have. And then the other people, the real policymakers, the people in the departments, will then stay on to get the more specific technical information from it. So I think we could do it in one document. I think that's the whole purpose of an executive summary too, is just to provide a general summary of the work that's been done. And not everybody's going to open this document. I mean, even general public, it's only going to be certain people that think, oh, I want to learn about this, or I heard about this, or maybe it came up in a Google search.
Well, I think that Emma Paradise's concern is that, you know, I mean, she and I think others who are actually affected by it, even though they're part of the general public, they are going to go into depth and try to find out how this is going to affect me and my family. I mean, as Nancy and you folks can say, you're going to, when you've got a personal interest, you stick with it a lot deeper. So I think we're okay with a single document.
And we have the online resource of the website too, for people to read any clarifying information if they, you know, whatever's not specifically included in the overview and the report can be found on the website. So I think a single document with an overview that's comprehensive enough would be sufficient, and people will dig in as they choose.
So let's go ahead and do, as somewhat, was it Wendy, I think, requested, let's go ahead and do the health first. So looking at the health document, which of course is the longest, includes the most extraneous, you know, appendices and so forth. Because the environment's quite straightforward. I think we can just put it in as is. What are you thinking about the health document? Do we want to include all that? And they've even sent us a PowerPoint that Mindy said she wanted included. So what comments about how we should handle that? Should we try to incorporate the PowerPoint in the report, or should we just put it up on the website and have a link to it? And so comments. Yeah, Nancy.
I would suggest that we include, when we broke up into subcommittees, we broke up into subcommittees based on the 14 requirements of the bill. So I feel like each of the subcommittees is addressing specifically the requirements of the bill. So the draft, the reports are based on those requirements. So I think that it's important to include each of the individual subcommittee reports, because they address specifically what we were tasked with addressing. I think that this health draft report is an overview of all of the things that we were tasked with to address health. So I think it would be important to include it. And I think the slide provides that in a really, a simple, quick and easy way to see the general categories and, but I think the actual draft report is a little bit more specific. So I would like to see it, both of those things included, in terms of the health subcommittee section.
It looks like because we didn't have the ability, or we didn't have the save chat enabled because of right to know reasons prior, that I can't do it mid-meeting. So if we want to keep typing things into the chat, it's not going to save. So I would suggest that we put them somewhere else.
Okay, well, I can do a screenshot here. That's what I do. I can do a screenshot. That's what I will do.
So Nancy, what I'm hearing you say is we'll have the health subcommittee report. Like if we take that, the environmental subcommittee report, the policy committee, put them all in one document and then start sorting and editing. And then separate from that will be the PowerPoint slides from the health subcommittee. Then we'd have to kind of augment that with what we get from the other subcommittees. And that would just be used if we need to describe our report. So we'd have a PowerPoint presentation that would kind of say, hey, this is the product of our first year. And then, you know, if you want more details, go to the interim report. I'm just trying to find the relationship between the PowerPoint slides you talked about that we received and the Word document.
I've seen other commission reports, and as Wendy had mentioned, you know, we have the appendices and things. These are things that were work product of our committee. So I think that it should be included. I mean, I think that like that slide presentation was not like from a single meeting. That was the compilation of a number of meetings and information, you know, obtained, and, you know, overviews about presentations that we had. So, you know, I've seen that included in other commission reports, and, you know, I don't see that how that would not, that information would be either not valuable or not helpful to understanding the work that we've done overall. I mean, you know, like we said, I've also seen meeting notes included. So you know, I think this packet, the draft interim report and the slide presentation are sort of the compilation of what we've done over the first, you know, prior up to the due date of the first report.
Okay, what I'm thinking of now is that, you know, in presenting this material in our press release, which we'll have a press release about this, in our press release and in our webpage, on our webpage when we have the report, what if we have a link to the entire report, which includes the overview, and then we have a link above it that is just the overview. So in essence, we would have two reports, but the second report would contain all of the first report. So it would say overview and then complete report.
Yeah.
On the website.
So if people just want to read the overview, they don't have to open the full document. They're just going to open a section of the document that's been saved as a separate. Yeah, I like that because it's still one document. It's just we're making it convenient for people just to get the overview.
What do you think?
I'm just confused. Are you talking about just on the site itself, or I'm talking about the actual submitted report? So you're talking about just a separate...
Are we actually going to submit a report in paper to these people? Is that what you're telling me?
No, I was just trying to, I'm confused about what would be included. So you're saying...
No, the complete report would go to the governor and the speaker and so forth. They would get the complete report. But on the website, there would be two options: to get the complete report or to just get the overview. And in the press release, when we give the URLs, it will have both the overview and the complete report, because you know the journalists are not going to want to go
right.
in.
No, good idea. I agree. Yeah.
Yeah.
That sounds good.
But in terms of including the the PowerPoint slides, I mean, there's significant overlap between the draft that was submitted this morning and the slides. Like some of it is word for word. To me, it seems a little redundant, but if the intent is to provide the information in different ways so that it's more accessible, I mean, I think there's an argument for that, but I don't know. I'm trying to think of ways to kind of synthesize, you know, I feel like the draft has most of the information from the slides. Maybe there are a couple things on the slides that are important that weren't included that we could add to the draft, just so all of the same information's in one spot. Does that make sense?
Yeah, I agree.
It does.
It
Yeah.
needs to be one. I don't think we should mix up a document and have slides unless it's like presenting data or information that you can't put into a narrative script. So, you know, if we had charts or something like that, that would then go into the document. So I think we could do, you know, keep the slides separate, but make sure their content has been captured in the report. You know, a good example, there was a wake boat commission that was chartered as a result of legislation, and they completed their report at the end of June, and it's a great report. I love how they did it, and on their website they have all the supporting documents that they refer to. So I mean, we have models out there for doing this, so I don't think we have to like reinvent the wheel as far as organizing it, as long as we agree what those buckets are going to be.
Right, I would agree. If we could include anything that's on the slide presentation that's not included in the report and just add it to the report.
Right,
Fine
right,
with me.
exactly.
I just didn't want to miss any of the stuff on the that overview slideshow.
Yeah.
Okay, that'd be fine with me too.
Okay, and then of course we'll include the slideshow in on the website,
Mhm.
and in the appendix it will be one of the reference documents. Yep. Okay, so can we look at the chat window? Can everybody look at the chat window, which I have photographed so I can keep it. So what we've got, if we look down, it says, I'm sorry. It seems to have sent everything privately to, okay, here's what we're gonna do.
Can you put it in like a Word document or PowerPoint slide
Yeah,
and then
that's-
just share your screen?
I should have, but because of the settings, it won't even let me copy what's on
Oh,
the chat. So basically I have to redo it all. Okay, which is annoying. So actually what I'm going to do is I'm going to pull up this picture that I've taken and share my screen. So just hold on a second here. That's very annoying. All right. Let's see here. Okay, desktop screenshot. All right, here we go. And now I will hit share screen. Yes. Whoop. Okay. All right, so you can see it now, I think?
yes.
Okay, so if you jump down, you can see that it somehow it went to Ava Hawks instead of everybody. So overview is going to include why created, what we've done, what's left to do, what we feel comfortable recommending at this point. Anybody have any changes or comments about that?
Oh, that sounds good.
Except that you wanted, well, maybe that's, you wanted a background,
Yeah, that's below here.
a
Okay.
history.
Yeah, so let's.
Oh, yeah, no, that should be in the.
Some of the background will be in the why created, but we're going to summarize it rather than go into the 14 points. So, okay, so let's, as we go through this then, why created, we're going to have Nancy do that, right? I'm going to assign things now.
Sure.
Oh,
Yes.
Sure, because that's based on the bill.
Yeah. Okay. And then what we've done to this point is somebody gets to go through all the subcommittee descriptions of what they've done and put together something a short summary. Anybody want to take that on? I'm willing to do that if nobody else wants to. Okay.
Well, to make things easier for the next report, we should have a template for each subcommittee that includes a summary that we can just grab like this.
Yeah, that's a good idea. Okay, so
Good idea. Yeah.
we can do that. What we want to do for the next report
Yeah.
can be what we want to do.
Organized reporting.
The template. Yeah, that's a good idea. Okay, so summary of what's done. And I'll take that on. And then summary of what's left to do. Somebody want to do that one? No?
It just depends how the other people, like, you know, if you look at our health report, we have a section that is completed tasks, uncompleted tasks, and recommendations. So it's
Right.
very easy to grab that from the health subcommittee, but if other people didn't do it that way, it's definitely
Yeah,
gonna-
well, it's only the environmental committee, the policy committee, that's not really appropriate. So it's only the environmental that we're going to have to take it from, and they have 2 sentences. So
All
it's,
right.
I'll be happy to do that. It's
So
actually
the thing is, in the health report, when you take a look at it, I mean, we called it out exactly of what has been done, what needs to be done, recommendations. I mean, so it's
Yeah.
just grabbing that section.
and that's great. We can use that for the template next time.
Yeah.
Yeah. Okay. So I'm happy. I'll do what's done and what's left to do. And then this last one is going to be a summary from what we come up with the policy. So let's skip over that for the moment. So that's going to be the policy summary. And we have 2 sections to the policy summary. One is legislative and non-legislative. Okay.
Mhm.
Okay, so, all right, then we get into the full report. So the background, RSA requirements and subcommittee creation. Nancy, that goes with what you were doing. So do you want to do that more? It's basically a more extensive version of why we created it. Are you willing to take that on? Nancy? Hello?
I think you're on mute, Nancy.
Muted again, sorry. See, yeah, what is specifically, could you repeat that, Senator Deitch?
Okay, so if you go down the page that we're looking at, it
Yep.
says full report, and under that says background.
Yes,
Okay, and then it says RSA requirements. So basically, you're just going to list
Yes.
the requirements from the legislation,
yes, sure.
and then talk about the fact that some of these are so complex, we decided to create subcommittees.
Okay, yes, sure.
Yeah. And then your last sentence will be, we decided to create subcommittees, and these are the 2 subcommittees, or the 3, actually 4 subcommittees. And here are the reports from the relevant subcommittees. And so then we'll do the environmental report, which only has a couple policy recommendations at the end. So we'll pull off those policy recommendations and just put the environmental report in as is. So there's no actual writing involved there. And then if you go down, you'll see next I have, actually you can jump all the way to the bottom where it says me to all panelists. So health subcommittee minus policy recommendations. So that would just take those 2 sections. Well, actually, I think you put it in one section. You put policy recommendations, and you had the legislative and the non-legislative were together. So we would just print the health subcommittee report with that last section pulled out. And then, so the big work is going to come in here is somebody has to take all the legislative recommendations from all the groups, the health, environmental, and policy, and put them together in some way that makes sense. So who wants to do that? So this is, I'm now at that capitalized section that says legislative recommendations grouped by category.
Well,
And
I think I would feel comfortable with the health subcommittee report with that draft we got this morning. I can compare that with the slides and just make sure that anything that was on the slides that's not in the report gets added. So that section is complete. I can double check that if that's helpful.
Yeah, that's a start. The second thing that has to be done is you got to pull all the environmental subcommittee only has two recommendations, so it's easy. But you need to pull those two from the environmental in. Maybe
Nikki,
even
did-
I think it
Nikki-
actually only has one.
Yeah,
That's
Nikki,
what I
did you see the notes from the policy committee meeting? I think Ava distributed them. From our meeting the other day, Nancy Harrington compiled all of the recommendations for environmental health and then just some general policy recommendations into one document. Did you get that?
Yes, I did get that.
Because those include the environmental recommendations. So I'm wondering if we could just take that policy document and categorize it by whether it's legislative action or non-legislative action, and then like the buckets,
Oh.
is
Yeah. That's what needs to be done. Okay, so they already did that work. Okay, great. Yeah, they would have to, of course. And what confused me is then they came out with a smaller number, so they obviously rejected some of the.
yeah, actually, when we talked about we had two policy subcommittee meetings, and the one we had earlier this week, we had just looked at all of them, went through them one by one, but there were some that were redundant with other recommendations, like education was one, education of healthcare providers. So we just kind of compiled them all, removed combined the redundancies together, and so it's in one list. And even though we attacked them by environmental, health, general policy, I think presenting them in the report, we don't have to distinguish like this was from the health subcommittee. We could just, legislative action, other action. And, so it is, I think if we look at the policy subcommittee report, everything is there.
Really, you think that that's all there? Okay.
I mean, the list of policies. I mean, we didn't go through all of the, the text or the justification that came through the like the health subcommittee report or the environmental subcommittee report. We just took the topic of what that policy was.
Okay, so I'm going to bring up that. I'm going to bring up the policy committee. Let's see, Pfas policy. There we go.
And as far as the health subcommittee, our recommendations will be very easy to put into two categories.
Well, what I'm confused about is, let's see, these are non-legislative. Okay, let's just look here at the policy subcommittee recommendations. So what I hear you saying is that, can you see this okay, everybody?
Yeah.
Okay, what I hear you saying is that these include all the recommendations from both committees?
Right, because we had Nancy Harrington reported from the health subcommittee. So she forwarded all her policy recommendations. And then Chris Badazian in the first meeting, and I think it was Nikki, you did it on the second meeting. You represented the environmental subcommittee.
It was Miss Paradise.
Oh, yes, it was Emma Paradise did. So she brought forward the environmental recommendations. And then I had taken the list from our last full commission meeting if you remember, near the end of the meeting, we compiled a list of policy areas that had been identified during the meeting. And
Right.
so we looked at those. Now, some of those were redundant with the health and environment. So this document represents the compilation of all those policy recommendations where redundancies were united with other ones.
Okay, well, so that work has been done then. And
Yeah.
That's super. That's super. So all we need to do then is to divide these up into groups according to what Rosemary was recommending.
Yeah, so I think if we
Yeah.
just put them into buckets, well, like
We
if
can do-
legislative, non-legislative, put them into buckets, and
Yeah.
then just give a little bit more explanation of where that recommendation came from.
Well,
And
I
if we
feel
have
like-
to include a link, then we could do that.
I feel like we can do that now. So, so we've got extend the statute of limitation. What are some buckets?
Buckets, extend the statute of limitations. That would be a recommended future legislation.
Oh, yeah, these are all legislative here.
Yeah.
But
Right.
what are the buckets within legislative?
I would say,
You had said it has to do with who's going to carry it out, right?
yeah. Well, when we get to legislative, I would look at, is it like extend the statute of limitations? That would be, I'm trying
That's
to
a
think of the
judicial or a legal.
judicial, right? So it'd be under judicial legal focus or bucket. I don't know. I'm at a
Okay.
loss for words.
Okay.
And one would be like health policy legislation.
Yeah, definitely.
Would be another bucket.
And we need environmental protection bucket.
Yeah.
Okay, so this one is environmental, right?
Yeah. Where fire suppressants have it. Yeah, because that would be under the authority of DES.
Yeah, okay.
And can I just say one thing about that, 1569? Not only is it environmental, but the purpose of that is also health. I mean, I know we have to put it under one, but we're looking at, the plan is to look at health exposure and health outcomes in those areas where there's been environmental exposure to AFFF.
But that's secondary to creating the registry, correct? I mean, the purpose of this
Yes,
bill. is
yes, yes,
registry.
yeah.
Okay, but I think this next one's primarily environmentally too, right? It would fall
Now-
under, it would
Right, and
fall
some-
under DES.
Right. And somebody drafting this, like when they talk about resubmitting 1569, they would say the intent of this registry would be to capture and identify potential health impacts
Right.
Right,
in communities.
right.
So that's an example of how you would build that out in the final report.
Yeah, but as far as who's in charge of doing it, it's going to be
Right.
DES.
Mhm.
Yeah. So support of a policy, well, we don't recommend support of a policy that designates state responsible.
1569 has been submitted already.
Yeah.
Probably that one thing should just say maybe recommend a policy rather than
How
recommend
about,
support of a policy.
I mean, the bill is going to say designate. Why can't I get rid of that R? There we go. And get rid of the S here. Or do we just want to institute educational standards and practices? I think.
Yeah, I like that.
We're going to get rid
I mean,
of a lot of this.
Right, when we wordsmith the final document, I think we have to really keep our word count as low as possible. We don't want to lose any meaning, but try to get rid of non-necessary language.
Is this an environmental or a health? I think of this, I think of DHHS and
Yes,
Yeah.
that would, yeah.
Okay. Whoop. And down a little. Okay. Okay. Now, strongly to provide any to the commission in a timely manner. Okay, this is not legislative. It's already
it's
in. It's already
non-legislative.
in the legislation. So.
Yeah, it's non-legislative. There's a couple more similar to that.
Okay.
I mean, I think when we get to the thing about the standards for foods, we may want to keep that non-legislative right now until that USGS study is complete. Remember, Mike Wimsat talked about that at our, I don't know if it was might have been the first policy subcommittee meeting or the last full commission meeting. They're approaching a partnership. It was the last full commission meeting. DES and USGS are embarking on a study of soil leachant and soil disposition. And I think that could tie in to what the Department of Agriculture could do as far as testing PFAS in food and recommending any maximum contaminant levels.
Where are we on this list now?
Okay.
I think we're on the chronic disease registry, and I think you can just modify it to create chronic disease instead of all the that. So you can just delete everything before create a chronic disease registry. I mean, basically that's the goal.
Oh, for some reason it doesn't want to let me. It's very strange. There we go. Okay. All right, that's under health, obviously.
Okay. And then get rid of everything. It should be a statement. All water exposure, including bottled water, be subjected to, I guess you could. So, yep.
Okay.
And that's health.
Okay, so
And
yeah,
then,
we're still under health.
The next one is just require any source company responsible. So turn it into a statement, a command.
Is that environmental? Or is that health?
No, that's
Would that
health.
be judicial?
Is it? It's medical monitoring, though. It could be either place. I mean, it's
We'll put it in health. You know very well that it's going to be up to the speaker or the president to decide where it goes. So we can just put it under health. Okay.
And then
All
blood samples.
blood samples. Yeah.
There you go.
Okay. Okay, and that's our health, obviously. Yeah, that's what we've been talking about. And then we have the letter to support that. Okay, establishment of a regulation.
Yep, that's fine.
Just require.
Mhm.
I'm going to put that. Yeah, I think we can put this in a more active way, but I don't want to rewrite it right now. It's kind of passive. Okay. Yeah, the next one we know, and that, where does that go?
Well, that's
Legislation.
legislative.
Okay. Is this right?
No, up one.
Oh, but these are all legislative. We had legislative versus non-legislative.
Okay.
Oh, well, whatever. Okay. Okay. Study the ability to act, to test and designate standard. Oh, this is the one you're talking about for the food. So we want to put this out as a future legislation.
I think it needs to be non-legislative now because I think we're waiting on more data and some of the study protocols and.
That's why I thought it would
Yeah.
be future legislation. I'm sorry, I lost.
Well, I think we should just go with Legislative, I'm just interpreting legislative as things that we could introduce as bills this year. And
Right.
everything else would be non-legislative. So unless it's something we could introduce legislation like this session or this year, then maybe
Right.
we should put it non-legislative. And maybe instead of non-legislative, we could put other, because it doesn't mean
Well-
that it is going to be, it may be legislative.
I would call it future legislation because honestly, if you just put this here, well, we'll temporarily put it here just to see it. Who's going to do it?
Right. Yeah,
See,
I'm
so
just looking at the,
I think
Yeah.
this is future legislation.
okay.
And, we might even want to, sorry, we might even want to describe, I've got this set on review, so it's popping over there, or tracking. Future legislation. And after, and what was the study that we're waiting on?
It's the DES/USGS soil survey. And I think that was said to be expected in early 2022. They're sampling, they're going to start sampling in a couple months, soils around the state. And then they're going to be developing analytical protocol.
Yeah, see, I like that as future legislation.
Mhm.
Okay. Okay, and then we have non-legislative. And so the non-legislative things is work that the commission, non-legislative work by commission. Right? So we're the ones doing this. Okay, and we can do that. And we can support the town of Merrimack. Not sure how we'll support them. But, okay, and strongly encouraged, yeah. So those are things that the commission is doing. Is that good?
Yep.
Okay, I like that, except the only thing that confuses me is this legislative is not an equivalent to the others. And
So-
so that's a big, a big
Well,
topic.
Perhaps
And
that should be proposed legislation. Or, no, because it's not all being proposed. Some of it's being resubmitted already.
I'm happy with the title here. I just don't understand this.
Well, if we've got future, maybe we need current.
Oh, you're saying this is already in as an LSR?
I think Nancy said 1569 has already been submitted. I've already submitted one for the statute of limitations. So,
And I'm going to be,
well,
oh,
let's just put this as a, because the problem is this could change day by day.
yeah, no, exactly.
I'm
and
going to
who
put that
knows?
in November, Senator. The Londonderry proposal.
Okay, but I'm not sure if it has, let's just, I don't want to put date, which ones have and which ones haven't, because that's going to change very rapidly. So let's just put, but my problem here is we've got these subheads and this first one has no subhead. That's what I'm trying to figure out. What committee
So it should be
would this go
commission
to?
adjustments or commission additions.
But what committee would probably hear this?
Oh, it has to go in as a, so it has to be through legislation. We can't vote on it inside the committee?
No. This is legislative. So what committee did your thing go to in the beginning, Nancy?
It went to resources, I believe.
Resources. Okay.
So that would be
wait.
like
Oh, wait.
energy for us in the Senate.
Which,
But it's an HB.
I should know this.
I know,
Ah,
I've had so many PFAS bills, I can't remember which ones went to resources and which ones went to Health and Human Services. It might have been Health and
You
Human
know what?
Services.
actually, and I think it might be resources. Actually, let me check. I can check.
Because Nancy, I remember you showed up with like a huge packet for every single one of our members.
Yeah,
I think it was this one.
Oh, so it was resources. Okay.
I think it
All
was.
right. That was what I was trying to accomplish. Okay. Okay. Whoop, I gotta get an R in there. Okay. All right. So now we have, and you're saying there's nothing that was in either of the subcommittee recommendations that is not here. Is that the case?
yeah, all of the recommendations have been included in the policy subcommittee report. But redundancies were removed.
Okay. All right. So
Can I just ask a question too? About the legislation? One of the bills that I had in last session was the PFAS provider education bill. And I'm not sure if that was 1538 or 1558, but that bill was tabled and just recently reviewed by Health and Human Services. And the recommendation was that basically be that the language in that bill basically be absorbed into Senate Bill 85 Commission because it was deemed not necessary for legislation, but absolutely important. And so that was part of the recommendation, was not recommended for legislation, but that given the work that would be an assistant in both that commission and 737, that that a subcommittee maybe of Senate Bill 85 take that up. So that's just specific to the health provider education bill. And now that there's hopefully some federal legislation that will pass to pay for that. That was the big issue, was the medical society just didn't have the resources, but there was an agreement, Health and Human Services and medical society. And I know we did discuss this in our commission, that the provider education piece, was important. So I don't know if that has to be someplace that recommendation was going to be, that Senate Bill 85 Commission will be taking that up.
So what we want to do is
Yeah, it was 1538.
HB 1538.
Yes.
Oh, it was one of the omnibus bills.
No.
Okay. Anyway, it's 1538. Commission or committee?
It was a commission.
Okay. Okay. And what else should we say here?
That though 1538 was not recommended for future legislation, the intent was important, and it was recommended that Senate Bill 85 include the work intended by House Bill 1538. Probably, let's see, include the, maybe we could say includes the recommendation of continuing professional development education initiatives advisory council. Maybe, yeah, I think we just take one line out of the bill. It will probably fit in there. So it would be ensure that Senate Bill 85 includes, maybe we could just say the goals of HB 1538 if that's the most simple.
Yeah, I was trying to give people a sense of what these goals were.
Okay. Okay, it is a continuing professional development education initiatives advisory council for certain qualified healthcare professionals relative to environmentally triggered disease.
Come on. In 2020, HB, what was that number again? 1538?
Yes,
Okay, but now what did we do? I'm sorry, my cursor's jumping around. Did that work? Okay, let's jump down here. Okay, HB 1538. Correct?
it was 50, yeah. Yes, yeah.
Okay, got to get an extra A there. Okay. All right. And obviously I will copy this out into a separate document and distribute it to everyone. All right. So that brings us back. I'm going to share once more the other document that we were looking at, which is our overview of our report. Okay, so we have done our legislative recommendations grouped by category. We also have a single future legislative recommendation, and then we have our non-legislative recommendations, not grouped by category, but we don't need that. All right, so I think the only other thing is normally you have some kind of conclusion at the end, which is going to be very cursory on this report, but I feel like we need some kind of paragraph at the end of all this. Does anyone have any ideas on what that should include?
Basically, it's not really a conclusion because it's just a short report, and the recommendations are really the conclusion. I would think just that sort of a status that this is an ongoing commission. The next report will be available, during this time frame. And if you have any questions or something like that, send them to a resource.
Let's just write that at the end of this, since we're there. Okay. Okay. All right. So you're saying this is an ongoing report, or
It's
You
an
wanna repeat
ongoing
that one?
commission.
pardon me?
It's an ongoing commission. And the next report, the next summary, status report, because these are status reports, right? These yearly reports. So the next status report will be available November 21, I guess,
Yes.
or October 21. When is this due?
November 1st. So that's before November 1st.
Okay. So it will be due just November 21.
Where's the 21 date come from?
Oh,
Don't we-
2021.
Oh,
2020.
2021. Okay.
And then for additional information or any questions, contact, I don't know, who's the contact for this? Would that be you, Senator?
I don't think we need to put a contact. Yeah, I would just say, the PFAS commission is ongoing, the work continues. The next report will be issued November of 2021.
Well, and then instead of a contact, then maybe just point them back to the website and say, additional information will be posted here as appropriate or something like that.
Well, I think we're going to have appendices, which will have a link to the website, you know, the section that has the minutes, the subcommittee reports.
Yeah, but just letting them know that the website is live.
Yeah.
And
Yeah,
that
and
it's
just say,
not static.
right.
So
Say the following website provides ongoing
Yes,
information
yeah,
on
Ongoing and
activities.
Ongoing and updated,
Mhm.
yeah.
yep, that's perfect.
Okay. Okay. And then comes the appendices. And that is that.
Yep.
Okay. Okay, so Nancy, if you will put together that why created section, and then the longer version of that, which is the background section that includes the RSAs and so forth.
Yes,
And get that to me, I'll be happy. I think we've really got it's a matter of cutting and pasting.
Mhm.
So I'll be happy to put this all together and then send it back out to everybody for review.
That sounds great.
And then we can send it out to the entire commission, and they'll have plenty of time. I wanted to have plenty of time for the departments to review it because they are so busy right now.
Mhm.
You know, HHS is just crazy. So
And are we going to have a group meeting, the entire commission to discuss this, or is it just going to be by email comment or what?
no, we will not, this committee will not have another meeting to discuss this. We will just put out the report, and we do need to pull together a press release about that report too. Nikki, would you like to draft the press release, or Wendy, do you want to draft the press release? Who would like to draft the press release?
I can take a stab at it.
Okay, so you drafted press release, and I think we'll just do that by email. Alan has said, you know, that sort of thing is fine to do by email. And then when we have all that ready, I think our date to have, let's see, we have a date to have everything out. And
You
then-
guys have a meeting on the 30th, I think, as a full commission at 10 a.m.
Yes, that's correct.
Mhm.
But we had other deadlines in the meantime.
Yeah.
So we will need to get the
I just posted in the chat what was in the email from
Great.
Ava.
great. Okay, that's super. So I will stop sharing.
And
we'll go to
Ava,
chat.
do you know, is there a template for press releases coming out of the House or anything?
There is it. So general, go ahead. Sorry, Eva.
No, Alan, please take the lead
I-
on
I was just going to say that usually it's just the same format that you would see coming out of any of the offices. You know, it's today the commission on Pfas, and then whatever statement, and then, you know, the last paragraph of a sentence or two be like, follow-up information to be found here. For comments or questions, please reach out to here. But just any press release that you've seen coming from the Senate leadership or House leadership, that's generally how it's done.
Okay. All right. Good enough.
Okay.
Thank
So, yeah, so if, let's see, Nancy, when do you think you might have your section done? So
let's see, which is a couple of days, beginning of the
yeah.
week, maybe?
Yeah, Monday or Tuesday. So
Okay,
if you have the stuff to me, say by Tuesday morning,
okay, yep,
and then I'll put everything together and try to get it off by Wednesday to all of us, to the communication committee. And maybe you could send out the press release draft by next Wednesday, Wendy?
Yeah, I can do that, definitely.
Okay. And so then we'll review that, and it's up to us to send that out to the full group on Friday. Okay, so that'll give us 2 days to look around and check back. And then
I'd be happy to, if you wanted me to proofread or copy edit before we send it out, I do that.
that would be wonderful. So we will yeah, we'll have the full thing out to everybody on Wednesday, and you can be the copy proofreader, and other people can look for more substantial stuff, substantive things. So then Friday, we're going to send it out to everybody. So that's Friday the 9th. And then by Tuesday, October 27th, anybody who wants to change anything in the draft before we send out, Rosemary and Ava and I will be, putting together an agenda with minutes and documents. So the departments or anybody who wants to change anything in our draft before we have the commission meeting, we'll have to have that in by Tuesday, October 20, or Thursday, Tuesday, October 27th. And then we'll put together, add anything that they want to change by that Thursday. Or if it's some huge thing they want to change, then we'll put it in maybe in tract form if it looks like it's something that everybody might not agree to. And then on Friday, we'll have the meeting in the morning, and we'll review those documents, which everybody should have had plenty of time to review. So it should be pretty minimal. I think because of the legislation, we'll also have to have quick reports from DES and HHS at that meeting because it's a requirement of our legislation. And then we will, once we've concluded all that and voted on these things as a report, then Ava will submit it, or Rosemary and Ava will submit it to the appropriate people. And we will send out the press release that Friday.
Excellent.
Does that sound like a plan?
Sounds good.
Sounds great.
Okay. All right. Hey, we're done before Wendy had to leave. Yay.
Thank
Okay.
you.
Well, I
Just gotta
thank
do
you
the
all.
adjournment. You guys gotta have
Right.
to the adjournment vote before you go.
Okay, I move that we adjourn this meeting.
Second,
Okay. And I guess we have to do a roll call.
Aye.
The other committees are not doing roll call votes on adjournment.
I know, they're
Sure
just
you've
saying.
noticed that,
Show
Alan.
of hands.
But we
Well.
only have 5 people. Okay, Rosemary.
Yes.
Okay, Nancy,
yes.
Wendy,
Yes.
Nikki,
Yes.
and I vote yay. Okay, we are
Great.
adjourned.
Great. Have a good day. Good job,
Thank you,
team.
everybody. Thank
Bye-bye.
you.
guys.
Bye.